Depression, a silent thief that can rob us of our joy and vitality. But understanding its causes and learning how to overcome them can lead to healing and hope. Depression can be triggered by a variety of factors, including biological, psychological, and environmental influences. Biological factors, such as genetics, brain chemistry, and hormonal imbalances, can all play a role in predisposing someone to depression. Below is some of the major causes of depression. Stressful events. Most people take time to come to terms with stressful events, such as bereavement or a relationship breakdown. When these stressful events occur, your risk of becoming depressed is increased if you stop seeing your friends and family and try to deal with your problems on your own. Personality. You may be more vulnerable to depression if you have certain personality traits, such as low self-esteem or being overly self-critical. This may be because of the genes you've inherited from your parents, your early life experiences, or both. Family history. If someone in your family has had depression in the past, such as a parent, sister, or brother, it's more likely that you'll also develop it. It's thought that severe depression in particular may be partly caused by the genes you inherit from your parents. But depression is usually caused by a combination of triggers, such as life events, so having a family history of depression does not always mean that you'll develop it. Pregnancy and giving birth. Some women are particularly vulnerable to depression after pregnancy. The hormonal and physical changes, as well as the added responsibility of a new life, can lead to postnatal depression. Sometimes postnatal depression starts before you give birth. Depression in pregnancy is known as antenatal depression. Menopause. Menopause is when your periods stop due to lower hormone levels. Sometimes menopause can trigger depression, particularly in the first few years. Menopause can also cause symptoms such as sadness and mood swings. Mental health symptoms caused by menopause are different from depression. Loneliness. Feeling lonely, caused by things such as becoming cut off from your family and friends, can increase your risk of depression. Alcohol and drugs. When life is getting them down, some people try to cope by drinking too much alcohol or taking drugs. This can result in a spiral of depression. Cannabis can help you relax, but there's evidence that it can also bring on depression, particularly in teenagers. Drowning your sorrows with a drink is also not recommended. Alcohol affects the chemistry of the brain, which increases the risk of depression. Illness. You may have a higher risk of depression if you have a long-standing or life-threatening illness, such as coronary heart disease, cancer, or a condition that causes long-term pain. Head injuries are also an often under-recognized cause of depression. Or severe head injury can trigger mood swings and emotional problems. In some people, an underactive thyroid, hypothyroidism, can cause depression. However, lifestyle factors like poor diet, lack of exercise, and financial stress can also contribute to the development of depression. Psychological factors such as past trauma, low self-esteem, and negative thought patterns can also exacerbate depressive symptoms. But the good news is there are effective strategies for overcoming depression and reclaiming your life. Overcoming depression is a complex process that often requires a combination of strategies tailored to individual needs. Here are some effective approaches. Here are some strategies you can apply in combating depression. 1. Seek professional help. Consulting a mental health professional, such as a therapist or psychiatrist, is essential. They can provide an accurate diagnosis, offer therapy, such as cognitive behavioral therapy or interpersonal therapy, and prescribe medication if necessary. 2. Build a support system. Surround yourself with supportive friends, family members, or support groups who can offer encouragement, empathy, and assistance during difficult times. 2. Stay active. Engage in regular physical activity, as exercise has been shown to release endorphins, improve mood, and reduce symptoms of depression. 3. Healthy lifestyle choices. Maintain a balanced diet, prioritize adequate sleep, avoid excessive alcohol or substance use, and practice relaxation techniques like meditation or deep breathing exercises. 4. Set realistic goals. Break tasks into manageable steps and set achievable goals to avoid feeling overwhelmed. Celebrate small victories and progress along the way. 5. Challenge negative thoughts. Practice cognitive restructuring techniques to identify and challenge negative thought patterns that contribute to depression. Replace them with more realistic and positive thoughts. 6. Engage in pleasurable activities. Participate in activities that bring joy or fulfillment, even if you don't feel motivated at first. Over time, these activities can help lift your mood and increase motivation. 7. Establish routine. Create a daily schedule that includes structured activities, such as work, exercise, hobbies, and social interactions. Consistency can provide a sense of stability and purpose. 8. Limit stress. Identify sources of stress in your life and develop strategies to manage or reduce them. This may involve setting boundaries, delegating tasks, or practicing stress reduction techniques. 9. Practice self-compassion. Be kind to yourself and practice self-care. Treat yourself with the same compassion and understanding that you would offer to a friend in distress. 10. Stay connected. Maintain social connections, even when you don't feel like it. Interacting with others, even in small ways, can provide a sense of belonging and reduce feelings of isolation. 11. Stay educated. Learn more about depression and its treatment options. Understanding your condition can empower you to make informed decisions and advocate for yourself in your treatment journey. 12. Consider alternative therapies. Explore complementary approaches like acupuncture, yoga, or massage therapy, which may help alleviate symptoms of depression for some individuals. 13. Monitor progress. Keep track of your mood, symptoms, and progress over time. This can help you and your healthcare provider assess the effectiveness of treatment and make adjustments as needed. 14. Be patient and persistent. Recovery from depression takes time and effort. Be patient with yourself and stay committed to implementing positive changes, even when progress feels slow or setbacks occur. It's important to remember that what works for one person may not work for another, so it may take time to find the combination of strategies that works best for you. Seeking professional help from a therapist or counselor can provide guidance and support, while connecting with others who understand your struggles can offer a sense of community and belonging. Cognitive behavioral techniques can help you identify and challenge negative thought patterns, replacing them with healthier, more adaptive beliefs. Engaging in self-care activities, pursuing hobbies and interests, and nurturing positive relationships can also help lift your spirits and improve your overall well-being. Remember, you are not alone in your journey. With patience, perseverance, and support, you can overcome depression and find happiness and fulfillment once again.